So the state of New Jersey is taking major strides in improving its standing when it comes to Black maternal health. Governor Phil Murphy just signed off on a new program designed to support new moms after they give birth. New Jersey is now only the second state in the country, in fact, with a newborn home nurse visitation program. And this morning we are joined by one of the women who made this all possible. Welcome, Senator Teresa Ruiz from Essex County. Good morning.
Good morning. Thank you for having me.
Yeah, absolutely. You know, this is such good news for new moms out there and expecting moms. Talk to me about this nurse visitation program. What does it consist of, and does it cost anything for new moms?
So it's going to be a completely free visit. I know that we're the second state in the nation, but it is going to be the most robust program in the country. And so the focus of it is to be sure that within the first 2 weeks of a parent coming back into the house with an infant, that they get a touch point with a nurse to visit right in their household, to just have a conversation, answer any questions. And in that space, we know that there can be several things that get identified. A parent can get connected to resources. The child can get connected to resources. And so critical things that could turn negative and within that time frame, we know we'll have a positive outcome and will save lives.
I tell you, as a mom, this would have been so vital for me, and I'm sure other moms can attest to that, because in that time frame, when you go home, there is that trepidation, that worry of, okay, now I'm on my own and I need some medical attention. I don't know what to do with that. I'm also trying to care for a newborn, so you're juggling so much. And let me ask you, though, this was personal for you as well, right?
100% personal. We're so self-absorbed in the care of the child and so concerned about them. When I brought my daughter home, I was a first-time breastfeeding mom, and the uncertainty of whether I was giving her enough food or not, it was really just weighing on my mental health and weighing on my physical health, in the sense that I was just stressing and obsessing about it. I was fortunate enough to have a lactation nurse specialist visit the home that was covered by my private insurance. And I will tell you, in the span of 5 minutes, she stripped my daughter down, put her on a special scale, asked me to nurse her, and said to me, put her back on and said, "You just fed her a couple of ounces." And I will tell you, after that moment, the sense of ease and comfort, and really the confidence that you gain as a new parent, getting that kind of level of expertise from a medical professional is really what will change the tide in this space.
Absolutely. And that's just one story, your story with breastfeeding. There are many other moms who have C-sections and other issues that they're dealing with while caring for the children.
Postpartum issues, postpartum,
depression.
High blood pressure. Several things. At the signing, it was very rewarding to hear stories of two women, one who had 3 children, and she explained very clearly, every child and every birth is critically different. So having that opportunity to have a nurse visit will provide different levels of resources and comfort. And then one woman who, if it were not for the nurse visiting her home, her postpartum preeclampsia would not have been identified. And I'm not so sure she would have been able to join us at the press conference. And so when you hear stories like that, even though my lens was personal, we didn't realize how much of a trajectory this bill will change the lives of new mothers in particular.
So when women hear this, they say, great, I'm eligible. How do you sign up for it? Do you have to have your baby in a New Jersey hospital, or you just have to live in New Jersey?
So
How do you qualify?
It's a New Jersey bill. The Department of Children and Families is geared up with the commission in the next 30 days to establish kind of the rules and the regulations. There is language in the bill that says at the point of discharge at a birthing center or at a hospital facility, you are supposed to be given this information so that a visit is scheduled within those 2 weeks. And the department will flush out the other concepts for, in fact, if you're an adoptive family that's bringing a newborn into the house.
All right, so there's a lot of parts to it. A lot of it's still being flushed out, but I want to talk specifically about Black and brown communities, because we see high maternal mortality rates there. How is this going to help with that?
So we know that our state, unfortunately, we rank #1 in several cases, and we rank a high to the top infant mortality rates specifically for Black women, which is an unacceptable fact. And so we're going to really change the tide here. We've had several pieces of legislation that have been aimed at this. Other pieces that I've sponsored in retraining implicit bias in the medical industry. We know for a fact that when a woman goes into an emergency room or is laying in a hospital bed, that when she's advocating for herself or asking questions, depending on how she looks like, what her language is, that's not being received in a way where the medical attention is being returned at the level that it should be. So you see Black women, dying in a moment where it should not happen. And this is not unique to the state of New Jersey. This is something that plagues every single state in the country. And you see the statistics, nearly 2/3 of the deaths are attributable to preventable causes. And so when you know that there are facts like that in place, we need to put in policy, training, making sure the next generation of medical professionals understand that if it's a Black woman, a Puerto Rican woman who's advocating and saying something is wrong, that voice and that lens needs to be looked through and heard.
Absolutely. All right, New Jersey Senator Ruiz, thank you so much for what you've done with this bill. Thank you so much for joining us today.
Thank you so much for having me.